Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, welcome to a new lecture today. I would like to discuss about venesection. So what are the indications of venesection? The indications of venesection include number 1, shock. The shock can be either hypovolemic shock, or it can be hemorrhagic shock, or it can be due to burns. The cause of the shock can be anything. When the peripheral veins are not visible due to the shock, even then you can do this venesection. There are no contraindications. The patient is put in supine position, and then you will give local anesthesia with help of 2% lignocaine. Local anesthesia is given with the help of 2% lignocaine, and then you will drape the patient and paint the site with bethadine iodine, and then here you can use either a saphenous vein or cephalic vein. Saphenous vein in the leg can be used for venesection, or you can also use the cephalic vein in the upper limb for venesection. The most common procedure is using a cephalic vein in the upper limb. So what we do here is so this is the elbow, this is the person. Okay, in the deltopectoral groove we will give a transverse incision. Okay, we will give a transverse incision about 5 centimeters in the deltopectoral groove, and then we will isolate the cephalic vein. Okay, 5 centimeter incision in deltopectoral groove, and then we will isolate the cephalic vein. Once you have isolated the cephalic vein, the distal end of the vein, if this is the vein, think that this is the vein, this is the proximal end, this is the distal end. Okay, the distal end of the vein is ligated. Okay, this distal end, it is ligated first, and then after ligating the distal end of the vein, you will make a small nick in the vein. Okay, and then you will introduce a small cannula into the vein. Okay, you'll make a small nick in the vein, and you will introduce a small cannula into the vein. Once you have introduced the cannula, now you will put silk ligatures above in order to hold the cannula in place. You can place it here, or you can even place it here, so that the cannula is kept in place. Okay, then you will see whether there is free flow of venous blood occurs in the cannula or not. Once there is free flow of blood in the cannula, now you will connect this cannula to the IV fluids, and now the IV fluids will reach the cubital vein. So this is one of the most common procedure which is done, where we use cephalic vein. Okay, now even the saphenous vein which we use, this is the similar procedure. Then what are the precautions? The main precautions is avoid, never inject air bubbles. Air bubbles should never be injected, because if air bubbles are injected, there is a chance of air embolism, which is an emergency and very dreadful condition. So avoid air embolism. And then you will have to the upper ligature here, the ligature which is given, it should not be tight, because if it is too tight, it will obstruct the blood flow here. So it should not be too tight, and it should also we should also follow the strict aseptic conditions. Now after you can also do long saphenous vein, or you can also do basilic vein in the arm, or cubital vein in the elbow. Anything can be done. All these three can be used. Closure, the skin is closed with sutures, and then post-operative complications are, there is a chance complications because if we inject air mistakenly, there is a chance of air embolism, and also there is a chance of infection. Okay, so these are the post-operative complications. What are the advantages of cephalic vein? Why only cephalic vein? Why not saphenous vein? This is because cephalic vein is a reliable vein, and it is easy to do so. If cannula is advanced into the right heart, then we can also measure a central venous pressure. So that is one more importance. The mobility of the patient is not restricted in this situation. So this is about the venesection. Thank you guys for watching my lecture.
Thank you, and thank you for watching.